I'm from Chicago, Illinois, and one of the big cities on the Great Lakes. And I am a naturopathic doctor, which means I practice in ways that are all natural, no surgery, no prescription. We feel that the body can heal itself if you give the body what it needs to heal itself. My passion has been in cardiovascular disease. I've written a book called Let's Stop the #1 Killer, which is heart disease. And I see it as a merciless killer, taking the lives out of 1 out of every 2 people worldwide. And it's completely unnecessary. Well, my vision, my passion, what I believe will really win the war against heart disease is actually twofold. One is non-invasive screening that's affordable. We know that a team of doctors who call themselves SHAPE, Screening for Heart Attack Prevention and Education, they posted or did a study in 2006 that said that in America we could save 90,000 lives and $21 billion annually. And what they called for was non-invasive screening of people that were asymptomatic. Now that means, first of all, non-invasive means no needles, no blood, no tears. And then the asymptomatic means no symptoms, because in America...
So you're screening people that don't have...
Any symptoms.
Okay.
In America, 300,000 Americans die every year, and I don't know what it would be here in Canada, but that's based on 300 million, so what would that be, 1%? 1%, I believe.
Yeah.
So 1% of Americans die every year of heart disease that is, there's no symptoms. The first symptom you have is death. And it's from something called cardiac arrest. Now, cardiac arrest is different than a heart attack. A heart attack, it develops over time, coronary artery disease, and we can talk about that. Starts at a very young age, 5, 6, 7 years old. It doesn't start when you're 20, 30, 40. It actually starts at a very young age and progresses very rapidly. But you get warning signs. For men, it is chest pain, pain in the left arm. For women, it's exhaustion. So, which is, women tell me a woman that's not exhausted. Yeah. And so they ignore that sign, or they go show up at the doctor and say, hey, I'm really feeling exhausted and tired. And they say, well, that's probably stress, anxiety. Here's some antidepressants. We'll see you again tomorrow. In the meantime, she drops dead of a heart attack because they didn't do that cardiovascular screening. So their recommendation, that task force of 40 cardiologists, and they sent it to all the other cardiologists, was to provide this non-invasive screening. We need new technology to scan people before it's too late, because by the time they come to us cardiologists, it's too late. There's very little we can do for them, and we are bankrupting the system. So my first idea is to screen people, get them an affordable screening, and then secondly, the solution would be a natural, something natural that they can take to either prevent or reverse if it's, they've already had a heart attack, or they have cardiovascular disease like diabetes or high blood pressure, or something else that could lead, or even erectile dysfunction for that matter, that can lead to a heart attack. Well, diabetes is, if we look at the end-stage result for diabetics, it is heart attack, stroke, blindness, kidney failure, or amputation. All of those are based on years of taking insulin, especially type 1 diabetics whose pancreas cannot produce insulin. They are on it from childhood on, so their lifespan is actually 10 to 15 years shorter. And what taking all that insulin does is hardens the arteries. And when the arteries get hard, they can't pulse, and then plaque starts building up, and eventually it leads to a lack of circulation, which leads to angina in the chest, or maybe dizzy spells from the carotid arteries, or gangrene in the feet. Then they get amputation. So yeah, so that's diabetes. Blood pressure, we know that if a person's blood pressure is elevated, they have 7 times higher risk of heart disease or a stroke. So we need to balance that. Now, medication that's on the market today It's good at lowering the blood pressure, but it does not treat the symptom. What's causing, or it's treating the symptom, not the cause. What's causing the high blood pressure? In many cases they don't know, so they start out with a diuretic to remove fluid. Well, not everybody is salt sensitive. Maybe 5% of the population is salt sensitive. Or they'll slow down the heart rate. Give them a beta blocker, slow down the heart rate. Yes, that lowers your blood pressure, but what ends up happening is when your heart starts beating slower, it's producing less blood, less oxygen. So then your other organs respond appropriately by slowing down. Your pancreas, your spleen, your gallbladder, your lungs, your brain, everything begins slowing down, and you end up with congestive heart failure. Diuretics also lead to cardiac arrest because when pulling fluids from your body, it's also pulling magnesium, potassium, some of those important things that help to establish your normal heart rhythm, which can lead to that irregular heartbeat, which can lead to cardiac arrest. So the ACE inhibitor would affect the kidneys. They affect the kidneys, adjust the blood pressure, but in the meantime, it's actually harming the kidneys. In fact, most medication harms either the kidneys or liver because they are toxic chemicals. And so they're not solving the problem, they're just kind of covering it up. Well, everybody's happy because your numbers are low, but then you have congestive heart failure or cardiac arrest or stroke or something else, but you went out with normal blood pressure and normal blood sugar, so, you know. Well, the solution has been in nature all along. And what's nice about it, it's something in nature that has incredible science backing it up. Oftentimes you take a product to your doctor and he'll say, well, yeah, go ahead and take it, but all you'll have is expensive urine. Well, this is something called nitric oxide. It was discovered, well actually it's been researched for some 30 years now, but 3 American scientists won the Nobel Prize in 1998 on the discovery of the role nitric oxide plays in the body. And the way they really discovered that was by accident. A lab technician was on vacation or called in sick one day, and what they were doing is they were working with arteries of rabbits, and then they were injecting nitric oxide and recording what was happening. Well, they were cutting the artery this way. Well, a lab technician took the day off, the other guy came in and he cut it the wrong way. And what they discovered is when nitric oxide was introduced, it widened. So it was a vasodilator.
So nitric oxide is a gas, is that right?
It is a gas. It actually is a gaseous substance that you can't inhale, you can't take from liquid or powder, you cannot get it at all. But it does, it's a vasodilator. So that led to the Nobel Prize for protection of the heart. Now nitric oxide does many other things. It actually softens the arteries. It melts away plaque. It has the ability to lower blood pressure. Vasodilation lowers the blood pressure. Actually, it works in three areas. One area is cardiovascular. It also works in the immune system. It builds T cells and T cell. I said that B and T and NK, which is your natural killers for cancer. So it boosts the immune system, helps to fight off parasites, viruses, bacteria, and then it also works in your brain and nervous system, the messengers that are being transmitted between the brain and the heart and throughout the rest of the body. So it works in all 3 of those areas. And so it's very important, but the problem is how do we produce it? You know, how do we? What they discovered was interesting because they knew nitroglycerin. There was something in nitroglycerin that was saving people from having heart attacks. It's been used since 1920s. You know, put it under your tongue, vasodilation. The problem with nitroglycerin is when you start taking it, you need to take more and more and more, and it's actually an explosive effect that can lead to a massive heart attack. But they said there's something in there that must be very important to the body, and the body must be able to produce it on its own. So it was the nitro part of the nitroglycerin. So then they said, well, there's got to be something else that we can use that can produce this nitric oxide. And that actually was discovered by Dr. Salvador Moncada in England. He discovered that an amino acid called arginine can actually create this nitric oxide.
And amino acids you get from?
Well, amino acids, the richest source of amino acids would be the things that your doctor tells you don't eat, like red meat and shellfish. So if you ate like 5 porterhouse steaks or 7 lobster tails every night, you'd have your own table at Red Lobster. But they'd love you, and you know, you might clog your colon for a year.
Right.
So it wouldn't be the route to go. But the green stuff and all that doesn't produce as much nitric oxide because it's protein sources. So that's where the red meat and dairy, you know, eggs, different things like that, are loaded with amino acids. And arginine is just one of 22 amino acids. And these are the building blocks of cells. In other words, they are the 2x4s of a house. Without the 2x4s, you can't have structure. And that's what gives cells structure. So protein is very important. You should get about 30% in your diet every day. Vegetarians actually get less, so they have to supplement even more with this arginine.